Good evening, everyone, and welcome to another Monday Night Live. My name is Laura Betts. I am the founder and facility director of HyperbaricsRx, located here in South Florida. And tonight I want to talk about one of the most well-known uses for hyperbaric oxygen therapy, specifically wound care. Now, interestingly enough, while hyperbaric tends to be best known for treating decompression sickness, it is used the most for wounds. And that's what tonight's topic is all about. And I want to talk about hyperbaric oxygen therapy for diabetic wounds, and specifically how when you save limbs, you save lives. So again, welcome everyone. It's great to see everybody on another Monday Night Live. Again, we do these every Monday at 6 o'clock, and we have a good selection of videos all over our YouTube page. So if you haven't checked them out, please do so. And tonight's topic is, it's inspired by a common conversation that I have. I was sitting today with another long-time client. He brings his son to us, and he was telling me about how a friend of his who is diabetic, essentially had multiple toes amputated. And they had their toes amputated while they were waiting for insurance approval for hyperbaric oxygen therapy. And after they got the HBOT, everything healed up great. But again, while they waited, they ended up with amputations. And I hear about this in my career all the time. Now, hyperbaric oxygen therapy is not covered by insurance for a lot of things, but one of the things it is covered for is specific types of diabetic wounds. They do need to meet a billing criteria, but diabetic ulcers are covered. And there's some interesting points, and stay tuned because I'm going to talk about this in this video and give you some real education here. And it's very frustrating for me. And as I go through this video and I emphasize some of the issues, some of the problems that happen with diabetic amputations and how it affects the individual, it will really, I hope, drive that point home. So again, welcome. For those of you that are listening to this for the first time, my name is Laura Betts. Again, I'm founder and facility director of HyperbaricsRx down here in Fort Lauderdale, Florida. Again, we do these topics every week, and we have a lot of topics that we've covered. And the last topic that we covered was hyperbaric oxygen safety. What is PVHO and why you should care? So I encourage you to really go back and check that out. Again, the hyperbaric industry is growing faster than regulatory enforcement. We don't need any more regulations in the hyperbaric industry. We have a lot of them. We've got a whole book of them. However, unfortunately, because the industry is growing faster than enforcement, a lot of things are going on. So again, I encourage you to check that video out. You can find our videos on our YouTube page. Our YouTube channels is HyperbaricsRx. And my firm was founded in 1999. It actually came out of some of my own personal experiences and my personal healing journey. You can hear my personal story. Again, there is a video of that on our YouTube page. I encourage you to check it out. We are one of the oldest hyperbaric facilities in the world. We were founded in 1999, and we are the only holistic hyperbaric center of its kind. So welcome, welcome. Now, just a little catch up, you'll hear me use the term dive. And when I'm talking about a dive, I'm talking about a hyperbaric session at an ANDI certified hyperbaric facility. Everything we know about modern diving, modern hyperbaric medicine comes from actually scuba diving, from treating diving injuries. So you're older, I guess I'm in that range now. So your old timers will use a lot of dive industry terminology, And of course, I have lots of diving origins as well. In addition to my diving experience, I sit on the Andy Diving and Hyperbaric Medical Board. I'm also Vice President of Substance Abuse Programming and Protocol Integration for the International Hyperbaric Medical Foundation. I've got over 35 years of experience. I've seen an awful lot of things in the hyperbaric industry, and I'm going to share some inside industry truths. And it is my hope that this information gives you actionable data, actionable items that you can take back to essentially improve your health outcomes. So welcome, welcome. So hyperbaric oxygen therapy for diabetic ulcers has been approved by Medicare since 2003. Again, there's about 14 indications that are covered by insurance in the United States. Some countries have more, other countries have a lot less. And one of the things that's really significant about our hyperbaric facility, about HyperbaricsRx, is we are a freestanding hyperbaric facility. We have hospital grade hyperbaric chambers, but we are a private concierge site. So you can access proper hyperbaric medicine at proper hyperbaric protocols with literally the best safety record in the world. Andy certified hyperbaric facilities have, as of the date of this video, a perfect safety record. So, and I don't expect to change that anytime soon, at least not here at HyperbaricsRx. So there's a lot to be said behind the scenes with that. So again, hyperbaric oxygen therapy, a lot of people are trying to use it for an indication that's not covered by insurance. But one of my absolute utter frustrations is that hyperbaric is covered by insurance for a pretty wide range of wounds, specifically diabetic wounds. Now, in diabetes, the circulatory system is compromised. The vascular system is compromised as a consequence. And I've talked in earlier videos about how hyperbaric is used to heal the wounds, but it doesn't necessarily address the underlying root cause, the diabetes, that's causing the oxygen insufficiencies in the first place. And again, that's another area where our facility is uniquely different. So in addition to offering clinical grade hyperbaric oxygen therapy in a safe, compassionate environment with trained and certified staff, we also have programs to address the underlying root cause, to give you nutritional education, to use targeted supplementation, and create an opportunity to not only heal those wounds, but prevent them from coming back by making educated, personalized diet and lifestyle changes. So again, we have an awful lot to offer you here. But getting back to the specific topic tonight, hyperbaric oxygen therapy has been clinically shown to reduce diabetic amputations by 75%. That's the reason why CMS approved it in the first place. It costs an awful lot of money to amputate a limb. And the argument that was made by the International Hyperbaric Medical Association, which was the medical board responsible for getting diabetic ulcers cleared, paid for by insurance, was that you're spending an incredible amount of money on the amputation. If you prevented the amputation, not only would you dramatically improve the person's health outcome, but you'd also save a lot of money. And unfortunately, insurance reimbursement, billing is very much about the business of medicine. There's an actuary making those decisions, not necessarily a compassionate medical professional. If it was up to me, hyperbaric oxygen therapy would be used in a much, much greater capacity than it is. And again, that's one of the things that's very different about our clinic here. Now, ready for a truth bomb? Amputations reduce life expectancy to 3 to 5 years. So when they start the first cut, when they take the first toe, that person only lives about 5 more years. And depending on how long it's taken for them to get treatment, and again, this is statistics, this is data, this is published research. Do some searches on it. Go to googlescholar.com. You'll see study after study talking about this. When you save a limb, you save a life. Amputations, and it would make sense if we're cutting off body parts, the person probably isn't in the best level of health. So, one of the reasons, one of the arguments, one of the reasons for the initial approval, in addition to the cost effectiveness, the cost saving of healing the wound, as opposed to the amputation, all of that care that's needed, the surgical intervention was very, very expensive. So healing the wound, and that's the reason why hyperbaric oxygen therapy is covered. But here's the problem. A significant amount of the cases do not convert. And I'll go back to the beginning of the story that I was talking about when I started this video. I hear all the time about this amputation in a diabetic, that amputation in a diabetic. And the fact of the matter is wound care itself competes with hyperbaric oxygen therapy. Wound care itself competes with hyperbaric medicine. Now, it is clinically known that once a wound reaches something called a Wagner 2, it is not a question of if the wound is going to heal, just how long it takes before they need to amputate it. It's well documented that once a wound becomes a Wagner 2, it's going to continue to progress to a 3, ultimately a 4, a 5. And the Wagner scale, it's a wound care scale. There are only 5 grades on it. And usually by the time a wound is reaching 4 or 5, the surgeon is in a difficult position because now they're racing infection, specifically sepsis. So they're going to amputate the limb to save the person's life in the immediate factor, right? But unfortunately, that amputation is going to reduce their overall life expectancy. And this is one of the amazing things about hyperbaric oxygen therapy. I have seen very serious wounds make they fully heal. It is possible. But the problem here is the system serves itself. And when I hear that somebody has been dealing with a non-healing wound for 6 months, 12 months, 18 months, 24 months before they convert them to hyperbaric, why didn't they just do a handful of hyperbaric sessions and heal the wound and have the person regain their quality of life? And the simple issue is that the cases don't convert. The wound care providers have no incentive to refer them to hyperbaric medicine because hyperbaric oxygen therapy is going to heal the wound. Now, again, hyperbaric oxygen is used in a reactive method there. And I would argue, again, let's address the underlying root causes and let's prevent this. The body was working fine, and now it's no longer able to get proper circulation to an area, and we're getting all sorts of challenges because of the oxygen insufficiency in the lower extremities. So what can we do about that? But I have to make the point here, you must be your own advocate here. Again, as I've mentioned, and it's really quite scary, but there is no incentive for the wound care firms, the wound care companies, and in these situations, they're going to debride the wound that's cleaning away the tissue, and debridement is very, very painful. And they're going to send people to the home, or if the person is still ambulatory, they are going to go to the wound care clinic and have their wounds essentially bandages changed. And that will go on for years. And when somebody has a wound, it really destroys their quality of life. You can't walk, you can't go places, you can't do things. I laugh sometimes. They tell them, well, you really need to start exercising. Well, how do you exercise if you can't even stand up and put any weight on the foot because the wound is so serious? So you must be your own advocate. If you get nothing from this video except this one point, hyperbaric oxygen therapy is covered for a pretty good selection of diabetic ulcers, diabetic wounds. You have to ask for it. You have to fight for it. You need to take an active role in your health and wellness. I have been in the hyperbaric industry for almost 4 decades, and I can tell you the cases don't convert. The caseworkers, whether they could or they should, they don't convert. You have to fight for yourself. And I will be forthcoming. If you do not make time for your wellness, you will be forced to take time for your illness. This is not something to ignore. It is only going to get worse. Once we've reached a Wagner 2 grade wound, it's not a question of if the wound is going to progress. It's just a question of how long that's going to take. And in that process, it is completely destroying and damaging quality of life. Now, I'll take this one step further. And this is another area where our facility can be a significant benefit. Now, Hyperbaric does have a strict billing criteria. That means that essentially there are conditions that need to be met in order for Medicare or private insurance to pay for it. And one of those conditions when it comes to wound care is the wound has to reach a certain grade. It has to be a Wagner 3, and it has to fail conventional wound care for a period of time. Now, I would argue if you left a wound and did virtually nothing to it, it's not a surprise that it's going to get worse. But again, there's an issue here with meeting the billing criteria. And the billing criteria doesn't acknowledge earlier grade of Wagner wounds. And I kind of shake my head at that. Well, how about we address the problem before it's a huge issue? How about we address the problem when it's a Wagner 1 and it's easy to handle? Why do we need to let it to progress to this serious wound? I mean, a Wagner 3 wound, there's no skin on that wound. It's muscle and beginning of infection. I mean, that's a very serious wound. So again, this is where you can access safe hyperbaric oxygen therapy in hospital grade PVHO ASME certified equipment at an affordable cash pay rate. And that's one of the biggest differences about our private freestanding facility. So it's not something that you want to wait on. And again, as I said, and I will repeat it, you must be your own advocate. Amputations are going to reduce your life expectancy to 3 to 5 years. In the story that my longtime client was sharing with me today, instead of coming and doing a few hyperbaric sessions, they waited for insurance coverage and lost several toes in the process. And, you'd say, oh, well, toes aren't that big of a deal. Yeah, they really are. They affect a lot of aspects of mobility. So it's another example where, again, you have to be your own advocate. You have to ask for hyperbaric oxygen therapy. You may even have to fight for hyperbaric oxygen therapy, but your life literally depends on it. By preventing even a pinky toe amputation, you are dramatically extending your life expectancy. Don't you want to spend more time with your family? Don't you want to enjoy life? Don't you want to live? So again, it is a big issue here. And at the risk of repeating myself, if you don't make time for your wellness, if you don't take an active role in your health and wellness, don't worry, your illness will make the time for you. And again, you must be your own advocate. Now, in a bigger picture here, as I've already mentioned, hyperbaric is under the reimbursement criteria. It's used very much as so many other things are used in, quote, standard of care. It's used in a really reactive method. So instead of addressing the underlying root causes from the beginning, we're going to wait until the problem gets really, really serious. And then we're going to do a lot of hyperbaric oxygen therapy in a really short period of time. And yes, that wound will heal. Again, hyperbaric oxygen therapy is clinically shown to prevent 75% of diabetic amputations. So that's really awesome. But why are we having these non-healing wounds in the first place? What is the underlying root cause of that? So our goal here at HyperbaricsRx is to find the root causes of your symptoms. Is it toxicity? Is it a nutritional deficiency? Is it both? What is going on here? Why was a working, perfectly normal, healthy human being now suddenly having challenges? So this is one of the many things that we do here. And this is also a good example of where a maintenance schedule, so doing a little hyperbaric, maybe once a week, maybe doing a bunch in a row, and then doing some ongoing hyperbaric to actually prevent the underlying oxygen insufficiency in the first place. And, usually the way this presents is something simple like they stub their toe. And because the body is not able to heal that injury, it gets worse and worse and worse. And ultimately, it reaches a Wagner 3. But the period of time in that process is months and in many cases, years. I mean, I shake my head when I hear 24 months of wound care. We could have handled that with hyperbaric oxygen therapy literally in a few weeks. So again, good things to consider there. So we offer personalized programs here, and our goal is to get to the root cause of the issue to help you heal naturally. We are the first and only holistic hyperbaric center of its kind. We're combining hyperbaric oxygen therapy with targeted supplementation and personalized diet and lifestyle changes. So look, it ain't easy. And there's no quick fix to changing bad habits that a person's had for a long time. But with guidance and coaching and proper whole food supplementation, we can do some pretty amazing things. So again, our facility, we are an ANDI certified hyperbaric facility. We have certified chamber operators on staff. And then again, we have integrated programs that will create an opportunity to address the root causes here. So programs to naturally support and rebalance the body. In addition to hyperbaric oxygen therapy, we offer personalized health improvement programs using targeted supplementation, physician grade whole food supplements, homeopathy, herbs, and special products utilizing carbon technology. And again, we will hold your hand every step of the way. We can't do the work for you, but I think you might be amazed. Your body's ability to heal and repair is much greater than you have been led to believe. So again, I hope that this was informative and gave you some really good points. And I encourage you to reach out to our facility. We offer a complimentary consultation, and I'd love to give you some more education on how you can heal and improve your health naturally. So again, it was amazing sharing information with you. My name is Laura Betts, again, founder and facility director of HyperbaricsRx. I look forward to seeing you next week. Have a great night.